All right, time for a little girl talk. You know, going to see your OBGYN can be intimidating, and there are some topics that you just maybe don't want to bring up. But today, we're going to do it for you. Our next guest is a board-certified gynecologist and knows how tough it can be for lots of women to ask their doctors about some of the most personal topics. Dr. Lisa Oman Earhart started Wyzetta Cosmetic Surgery and Spa for that reason, and today she is here to help us get some good answers. Nice to see you, Dr. Lisa.
Nice to be here.
This is a real passion for you. You want women to feel okay and comfortable talking about every aspect of their bodies and their health, right?
Absolutely, absolutely. It was actually one of the reasons that I started my clinic to begin with, because I felt like this area was just had very limited options for talking, and if you can't talk to your gynecologist, who can you talk to?
Yeah, I think a lot of us too. I mean, you get really comfortable talking about issues when it comes to childbirth. I mean, that's something a lot of people can relate to. You kind of get to the point where you sort of are forced to be comfortable talking about it. But it's those issues that happen beyond. So we're going to tackle 3 topics that women are nervous to bring up, okay? Don't get nervous, because I'm going to bring it up for you. Low libido, all right? Let's talk about this one. This is something that a lot of women are struggling with at different times in their lives, and it can be really detrimental to their relationship. So what's happening here?
Sure. So absolutely, low libido I think can be devastating. It's very unexpected. It begins to happen very slowly in a woman's early 30s and can escalate in your 40s and become a real issue in your mid-40s. And it really basically is a result of your natural testosterone levels that are produced by the ovaries begin to really fall. And it is, again, something that can affect every aspect of your life, where your relationship can be affected, you personally, your confidence, all of those things can be affected by your low libido.
Okay, so going in and saying, I want to talk about this with my doctor, first of all, that's something that you think women should feel okay about doing?
Absolutely, they should feel comfortable, but we're not programmed to ask those questions. And very commonly, women don't even quite know what's wrong.
Okay.
You know, they will come in and they'll just talk about fatigue and they'll talk about other things without necessarily talking about the libido. It's very common that I actually have to bring it up.
Okay, so what are you recommending for a lot of women? What's making a difference?
Well, I personally began to experience the symptoms of menopause in my mid-40s very dramatically, and prior to that time had a very positive and good sexual experience with my husband intimately. And
you guys work together,
yes.
So yeah, you spend a lot of time together.
Yes, we have 4 children, and we're both physicians. But ultimately felt that drifting along with the other laundry list of menopausal symptoms that you began to experience.
Yeah.
So that's when I sought bioidentical hormones as an alternative to synthetic hormones, including testosterone, which is the key. And again, it's very interesting. The testosterone very commonly is identified as something that's male, but it is made by the ovary. The same ovary that makes estrogen and progesterone also makes testosterone.
Yeah, so not necessarily something women would think to ask about, but when you start to explain it to your doctor, maybe they can come up with those options. Tell me about this Mona Lisa touch. What's this thing?
Yeah. Well, the other unexpected symptom can be pain and discomfort during intercourse.
Yeah.
Again, something that women find to be embarrassing and again, very unexpected. And Mona Lisa Touch is a brand new, innovative, non-surgical, non-hormonal, non-painful 5-minute treatment that can completely rejuvenate the vaginal tissues, basically restoring it back to a very youthful condition.
Oh my gosh.
Yeah, it's phenomenal, and it's especially helpful for women who have breast cancer or who are survivors who otherwise don't have hormones as an option. So it basically stimulates collagen and other growth factors that help to bring back the tissue, the moisture, the elasticity, blood flow. It improves the nerve sensitivity, so the overall arousal is also enhanced. And by the way, it can also treat incontinence issues. So
that's a big thing. All the ladies who have had all these babies.
Enormous. It's enormous. So we've seen just profound, dramatic, life-changing results.
That's incredible. Okay, let's talk about another topic that maybe women don't want to ask about, and this is the unexpected pain during intercourse. What's happening here?
Well, again, it's really the loss of hormones, the loss of estrogen, the loss of other hormones that are leading to thinning of the tissue. That leads to the lack of moisture and the discomfort that the patients are feeling.
And that's, again, that Mona Lisa touch can make such a big difference.
Yeah, so Hormones have been commonly what has been used to treat them.
Yeah.
There is a pill, a new medication called Osphena that has also been found to be helpful. But again, all these medications have side effects. And the amazing part about the Mona Lisa treatment is that it's long-lasting, it's non-hormonal, non-surgical, and has such profound effects very, very quickly.
Wow. Okay, our last hot topic. I'm going to say two words that I didn't necessarily think I'd ever say together on television, but today's the day, my friends. Vaginal looseness. Yep, you can put that on repeat on YouTube because here it is. But listen, if we can't talk about it here, how can women talk about it? What's the issue here, doctor?
Absolutely. Well, you said it. And
I did.
Yes, exactly. So it's a very common thing that can occur either progressively after childbirth or sometimes as a result of just aging, where there's a loss of sensation, loss of friction, loss of sexual gratification,
Yeah.
and it can actually affect both partners. It's commonly affecting a woman's self-esteem as well, and women don't often realize that there are options for treatment. The thing that I find most fascinating, I do cosmetic rejuvenation of the pelvic area.
Okay.
So I do vaginal rejuvenation procedures, which basically restores the vagina back to the way it was prior to childbirth.
Which is the best name for a procedure. I mean, really. The
Yeah.
rejuvenation. Go for it.
Yeah, and you know, like I always say, if this were men that were having babies through their parts,
Yes.
and things weren't quite the same, this would be a national healthcare crisis.
I
I'm
think
sure
you
of
are
it.
100% right. And let's be honest, if there were men having babies, we probably would have fewer babies. Right, Steve Patterson? Yeah, I am correct, he says. Dr. Lisa, thank you so much. So
it's
nice to
my
have
pleasure.
you here.
My
We're
pleasure.
looking forward to talking to you more in the future. And to learn more about the Mona Lisa Touch, call Wyzetta Cosmetic Surgery and Spa for a free consultation. And then during the month of October, new patients can save 20% off of that procedure. All the details are on TwinCitiesLive.com. And Dr. Lisa will be back next month. We're going to talk about the unexpected side effects of cancer and your sexual health. Big issue for a lot of women. We want to thank Wyzetta Cosmetic Surgery and Spa for sponsoring the show. We'll see you soon. Thanks.
you.
All right, still to come, we are talking tune in.